Welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today is Dr. Tina Mahajan, Division Chief of Female Pelvic Medicine and Reconstructive Surgery at University Hospitals in Cleveland, Ohio. And she's with us today to talk about a condition known as Nocturia. Welcome to the program, Doctor.
Thank you very much for having me.
Thank you. You're the Division Chief of Female Pelvic Medicine and Reconstructive Surgery. How long have you been a doctor?
I've been a physician for, that's a good question, almost, 18 years since I finished medical school. And I've been at University Hospitals Cleveland Medical Center for 11 years and started the division. So they really had nobody who does what I do until I came.
Well, having no one that does what you do at a hospital, especially in places large and Cleveland, how did you become a specialist in urological conditions?
Well, I did 4 years of residency at Washington University in St. Louis in obstetrics and gynecology, and then I spent 3 years of fellowship focusing on just female urologic and prolapse issues at Loyola University in Chicago, and then they plucked me out of fellowship and had me come here and start a division. So,
were there some personal issues that made you go toward this particular field?
Well, that's a good question. I knew that I wanted to go into gynecology ever since I was in college. I was very interested in women's health and women's issues. And back in the days before you could even major in women's studies or anything like that, and I knew I wanted to go into medicine. I come from a medical family, but everyone is a lung specialist in my family. But I knew I wanted to be a surgeon because I've always been good with my hands. Mm-hmm. And when I got to medical school and did some OB, I was not as interested in the babies. I was more interested in the moms. Mm-hmm. And I loved plastic surgery, but I didn't want to be a plastic surgeon. So the nice thing about what I do is it's sort of like plastic surgery for down there. I tell all my patients, no matter how old they are, I'll make them look like they're 20 again, although nobody ever sees my work. Mm-hmm. Not many people see my work, hopefully, but it's plastic surgery meets urology meets gynecology. My husband likes to say that I give women dignity.
Well, there you
go. Keep women out of diapers and other things. So let you have your life back and do the things that you enjoy and not feel like there's something limiting you.
We mentioned, or at least I mentioned, a condition known as Nocturia, one that I've never heard of, yet more than a third of adults over the age of 30 seem to meet the clinical definition of Nocturia. What exactly is Nocturia?
So by definition, Nocturia is defined as any getting up at nighttime when you should be sleeping to urinate. You should be sleeping before it. It should be preceded by sleep and followed by sleep. And it's for basically the specific reason of urinating. It shouldn't be because my husband snores, my dog's barking, or whatever, but I specifically have to get up at night to empty my bladder, and then I can go back to sleep. Now, the difference is, most of us get up maybe one time a night some nights, but sometimes it's for a variety of reasons, not sleeping well, distractions, other things wake us. But bothersome nocturia is defined as getting up 2 or more times a night. And I have patients in my practice who get up 7 or 8 times a night, and there's no way you can get rest if you're getting up every hour and a half.
Nocturia, you're getting up that much. I've heard different causes for people, getting up. Overactive bladder. Is overactive bladder separate from nocturia, or is nocturia a severe overactive bladder?
Well, it's a very interesting paradigm. Overactive bladder includes one of 4 symptoms: an urge to go that I cannot defer, urge incontinence, that urge to go is so bad that I leak, nocturia, getting up at night to urinate, and frequency, I've defined as I feel like I pee too often. So the average number of times, what do you think? An average person in the United States urinates how many times a day?
Oh, maybe 3.
What would your guess be?
Maybe 3?
Actually, it's 8.
Really?
8 is average. Really? I'm not average. I definitely don't have time to go 8 times a day. Yes. We did a study when I was a fellow, and we interviewed people, and anywhere from 6 to 10 is the range, and 8 is normal.
Now, does that matter if you're drinking that 8 glasses of water a day that I think most
Right.
people recommend, or
So that definitely affects things. Or if many of my patients, if I'm drinking a pot of coffee on the way to work, of course I have to pee a bunch of times when I get there. My bladder cannot hold that. So there are many factors that can affect how often we urinate. But for the average is 8 times a day, and if you go more than 8 times a day, or let's say you've always gone 3 times a day and now you're suddenly going 8 times a day, that's considered going too often for you. That's a change.
Okay.
So, but it's definitely affected by if you drink a lot of water, if you drink a lot of caffeine, alcohol, do you take a diuretic to lose water? But there are definitely factors. So getting back to your question about nocturia, there's a large population in the U.S. of people who have overactive bladder. And many of those patients with overactive bladder have nocturia. And if we look at just people who are bothered by getting up at night, it's 63 million people in the United States. About 33% of women and 21% of men get up 2 or more times a night.
Now, I'm thinking about the water drinking. Many of us decide at some point to embark on this healthy lifestyle as far as diet is concerned. And of course, drinking more water is crucial. And a lot of us who do that, we're used to coffee and soda and the assorted juices. So I'm going 3 times a day, and I'm got less than healthy liquid intake, and that being the content as well as the quantity. But then I start drinking a healthy amount of water, and I'm going more. This is specifically talking about nighttime, right? Just nighttime. It has nothing to do with going as a result of drinking more.
No, this is during the daytime, that's fine. In an ideal world, when you sleep, your body secretes a hormone called vasopressin, which is supposed to concentrate urine and make you make less urine at nighttime. But as we get older, that release of that hormone decreases. So we don't concentrate as well. So we make too much urine at nighttime, and we have to get up and urinate. So that's the fundamental issue. Okay. Now, what happens during the daytime when people are drinking a lot, that's normal. I always tell people fluid in, fluid out. If you take it in, you got to take it out. And that's to be expected, but people aren't usually bothered by that. So this is getting up at night in a bothersome way. Okay. And again, usually I tell people more than 2 times a night is bothersome. Once in a while, I'll catch somebody who takes a water pill at bedtime and is sabotaging themselves. Or let's say they take 3 or 4 supplements at bedtime and they're drinking each one with a big glass of water. And they're just sabotaging themselves because, again, fluid in, fluid out. So we can easily modify things like that. Take your supplements before dinner with 1 big glass for everything. Move your diuretic to the daytime. But those are easy fixes. But the majority of our patients are not as easy.
Are there other things that are affected by nocturia? I mean, if your sleep is being interrupted to such a degree, and it's bothersome, well, more than bothersome, what are some of the other things that could be affected simply because you're not getting enough sleep? And is that the main thing as far as nocturia affecting other organs or other systems? Is it because of the lack of sleep?
Well, we all know that, especially like when you have a new baby and you're home every 2 or 3 hours feeding your newborn, lack of sleep makes you exhausted. You are not as good at cognitive tasks, things that you have to think about. Your memory goes. You just don't feel well. And the biggest thing that I worry about in my patients is falls. If a patient falls and breaks a hip, they have almost a 50% risk of dying from that, or significant medical issues. And many patients who get up at night are getting up and they're falling at nighttime. So one of the big reasons when people fall is because they're getting up to use the bathroom at night. Yeah. So, in my patients, you just don't feel good, you don't feel well, you're not as on your game, you're not mentally as good as you should be, and you're at risk for harming yourself. So there are many things that helps. And then the other thing can be obstructive sleep apnea. Many people snore, wake up with a dry mouth, wake up with headaches. And a lot of people don't want to get their sleep apnea checked out. Or if they do get checked out and they do have sleep apnea, they don't want to wear their machine, their CPAP. And that puts strain on your heart, puts strain on your lungs, and can definitely take years off your life.
And where can our listeners go and get more information about nocturia?
They can definitely go to our national website, www.augs.org, or plenty of other resources in the urogynecology world.
Well, thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Tina Mahajan. She's the Division Chief of Female Pelvic Medicine and Reconstructive Surgery at University Hospitals in Cleveland, Ohio. It's been great having you here with us today, Doctor.
Thank you very much for having me, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.